This is the whole concept of heart attack. Then how to prevent it? That is the most important thing. Without knowing that how to prevent a heart attack, we'll ultimately end up inside. So what are the commonest causes of heart attack or heart blocks? The first and number one is the family history. If I'm asking this question to a person, what are the commonest causes of heart attack? Or if I'm asking why we are having so much of heart attacks happening in these or there is an increase in the number of heart attacks, they will say that this is basically because of absence of exercise and consumption of fatty and fatty foods and those um, uh, taking so much of mainly because of the unbalanced diet and all those things. But if you ask me, the most important cause of heart attack is your genetic makeup. So some people are born with a genetic makeup which makes them prone for heart attack. So how do we recognize that? It's very difficult. So there are tests coming up. Maybe 10 years down the line, we will have a blood test which is drawn at the time of birth itself. A baby is born, and we have taken a blood. We did genetic analysis of hundreds plus genes and says that the probability of getting this person heart attack at the age of 40 is 80%. Means it's very high. So that this person, this baby, can prepare himself or herself from the birth itself for a heart attack, and he can avoid a heart attack by changing the other areas which we can modulate. For example, so such a thing is coming up, but till for up to now we don't have such a test. We don't have such genetic analysis which predicts the heart attack to us. So these are the one of the important things. So how do we recognize whether this person is having a or is he prone for a heart attack? Most important thing is family history. So if his father or mother or brother or sister had a heart attack at a younger age, he is also prone. Maybe he is also prone. We don't know. So I had a patient. His father had heart attack at 45 years and died. Hmm? This guy had a heart attack at an age of 23 years. 23, you can imagine, 23 years. And no one in his family or uh, or the doctors even, they didn't recognize that he is having a heart attack. And his heart pain was misdiagnosed as gas, stomach upset, and he was advised admission. He was in the hospital from morning to evening without giving any treatment for the heart attack and without even taking a single ECG. And when the ECG was taken in the evening, his condition was so bad, and he was brought to me where his pulse was very weak, his BP was very weak, and we told the relatives that there is a minimal chance that he may survive, but we cannot agree anything. We cannot assure you anything on the prognosis of this patient. But luckily, he survived and he is doing well now. So this is the story of heart attack. We cannot expect it. It can be sudden, very sudden, maybe at a younger age. So if you have got family history, you should be very careful. You have to see a cardiologist saying that one of my family member is having a heart attack at a younger age. So I heard that my risk is high. I just wanted to assess my risk and prevent the heart attack at a younger age. The second part. Second thing is the second most common cause of heart attack is smoking. A smoker has got 6 times risk of heart attack. Either it is active smoking or passive smoking. Passive smoking is less injurious, but we do have passive smoking. What I found when I came to Dubai, multiple times I've been there. Uh, Smoking is allowed in public places, especially in lifts. People used to smoke in lift, common areas, and all those things. I don't know whether they are supposed to do that. I have seen people not removing their cigarettes, even entering in the lift and all those things. And some of the areas when I went for parties and all those things, it is full of smoke. So it was very difficult to breathe in that areas. But when Kerala banned this public smoking, we do get, I don't get a smoking smell when I'm going out. And even in any of the areas, nobody will smoke publicly. So that helps a lot to avoid the passive smoking. Then third point I want to remind you is that you should know your numbers. So I just want to ask you, what are your health numbers regarding heart attack? Means there are three things you should know: diabetes status, the lipidemia status, lipid status, and the blood pressure status. So when I meet someone and I used to ask them, oh, are you a hypertensive? They say, no, I don't have hypertension. I don't have BP. The next question will be, when did you check your BP last time? Then the answer will be maybe 6 years or 7 years. So even though he is saying he is not hypertensive, the actual situation is he don't know whether he is hypertensive or not, because he hasn't checked his BP for the last few years. So this is same for blood pressure, the blood sugar as well as cholesterol. For some of the people, they assume that they will not get these diseases and they will end up in heart attack. Then only they'll find it. They are having a diabetes and all. So for an easy way, it's not for everyone. For an easy way, a usual person should have a cholesterol, LDL cholesterol of less than 130, a fasting blood sugar of less than 110, and blood sugar after food should be less than 140, and your blood pressure should be less than 135 or 85, at the max 140/90. This is for a normal person. For a person who is having additional risk factors, let us say the previous person, a family history of heart attack, his cholesterol should be very low. So that's why I'm saying that a person already having a heart attack, family history of heart attack, should have a more control of his risk factors. So third point that I highlighted is the know your numbers. You should know what are your numbers at least once a year. And the last two parts, this is the most important thing when we see the community as a whole. Even though the impact on an individual is less, the impact on a society is more for these two things. The first thing is diet, and second thing is exercise. And the third thing, it's clubbed together, stress. Diet, exercise, and stress. These three things are interconnected. If you start an exercise program, most probably your diet also will be good and your stress levels will be less. If you don't exercise, your stress levels will be more and your diet will be disorganized. This is what I've seen many times. So diet, exercise, and stress, I'm clubbing it together to make it easier. So how much you should exercise to prevent a heart attack? That question was thoroughly discussed in many of the forums. And they found that at least 20 to 30 minutes of vigorous exercise per day, at least 5 days for a week. So 5 into 30 minutes, around 150 minutes. That's for exercise. The second thing is the diet. So we used to hear so much of about diet. There are so many diets out there, and some of these diets are very famous, like the keto diet. Some have the Atkins diet, the high protein diet, low carb diet, no carb diet, balanced diet, then Mediterranean diet. So many diets are there. But the problem with diet is that the identifying a diet which is healthy for us is very difficult, because the impact of this diet on a person is very minimal. So if you want to study the impact of diet on a community, we have to study at least few lakhs of people over a few years on a specific diet. It's very impossible. You cannot ask the person, you have to take this diet for next 5 years and be in my study. He may fluctuate, so that quality of the study will change. But even then, people have tried this and they have found out that the diet which is the best is the balanced diet. What is the balanced diet? Balanced diet will have everything which is required, like a small portion of carbohydrate, maybe your rice, chapatis, or idlis, doshas, and all those things, and some portion of protein, like fish, small fishes, big fishes, also nauseous, chicken or mutton or something like that. Fat also, little bit fat is required. Then there should be provision for green leafy vegetables and usual vegetables, and for fruits also. So if you come everything together in a single plate, this is a balanced diet. Why? Because why there is a single plate means, otherwise the first portions, like carbohydrate and protein, will take the space for the vegetables, or you should start with the fruits and vegetables first, then go for the carb and protein. So this is what a balanced diet means. Then exercise I told, diet I told. Then regarding the stress levels, stress levels, I think the empowerment talk and your 5 a.m. club, all these things are basically to motivate you, to reduce your stress, and to increase your productivity. Okay, so these activities will help you. These combined activities will help you to reduce your stress, to get more out of your life, and all those things. But still, stress will be there for everyone. Stress will be there. So I was, when I was started that, we had some training on yoga, breathing, and all those things. So these stretching exercises plus breathing exercises, they do help. And the mindset of our mindset will help us to reduce the stress level. So that mindset, I had a discussion previously in the same forum itself, and some of the qualities that we keep with us will help us reduce the stress, and that will help us more happy. A happier person will have less stress, is healthier person. More laughing person is healthier and will last long. So that's why there are laughing clubs and all these things are happening. For that part, I should tell you that I started reading some books. Just now I told you about 5 a.m. club, miracle morning, and all those things. So all these things, all these books written over a period of many years difference. Like one of the book was written in 1989, another book was in 1994, another was in 1906, another one was 2019. So after reading the getting all these books, around 50 books, I found out that there are some universal laws which is abiding to our mindset, our behavior, our happiness. Like there are universal laws of physics, like gravity, electromagnetic force, and all those things. So there are some universal laws. So if you align yourself with these universal laws of human behavior and human mind, you will be happy. If you deviate from this universal laws, you will be unhappy. So finding out which are the universal laws is the task that we should focus. And some of these universal laws will be very prominent. And if you break it, you will be in real trouble. So all those good values that we count on are the universal laws, just like trust. If you break the trust, you are affected. Somebody will be not trusting you because there is a breach of trust. Then if somebody is not trusting you, then you will feel bad. Your dignity is low. Your self-esteem will go down. Your happiness will go down. I just gave an example. And there are some good qualities like gratitude, forgiveness, and giving. All these things will make you happy. I don't want to go into the depth of those topics because my focus today was on a health education talk on heart attack and its prevention. So I have concluded saying that heart is the primary organ which gives blood to every organ. Heart should be strong, And for the heart to be strong, its blood supply should be continuous. There should not be any block. And there are some conditions like heart blocks as well as heart attacks, which are different. And the same sign or symptom of heart attack is angina. I have described it. And once the patient has got angina, we have some treatment modalities. I didn't go into the depth of these things. To prevent heart attack, we should have a good genotypic preparation, which we cannot do anything about the genetics, but we can predict heart attack and prepare for it and can avoid it by doing some things. Second thing, I was talking about quitting the smoking. Third thing is to knowing our numbers of hypertension, blood pressure, diabetes, and hyperlipidemia, that is the lipid levels. And fourth side, I club together three things, that is diet, exercise, and stress. All these three things are interconnected. So if you master all these things, the chance of getting heart attack is very low. It will come down very drastically. And I hope every one of you will have a healthy heart as well as healthy life in the coming years. Why I said about why we are talking more about prevention and more about talking about this health awareness is that I personally, being a doctor, cannot reduce the burden of heart disease in the community. What we are doing is, once the person is getting disease, we are treating them. But when we are giving a preventive talk, we are going further ahead and we are trying to get a situation where the disease is not happening. That's what we want. And this was accomplished by the American people. When there was an increase in heart attack year by year by year, they started their preventive techniques. They started doing their blood checks free, and they did a lot. And the death due to heart attack is coming down in US. So that can be applied to every part of the world, and we should provide the information required for that. That's what I'm doing now. I hope the talk was clear, and if you have any doubt, please feel free to ask me. Thank you.
Thank you, sir. That was a really wonderful session. It was really knowledgeable and informative too. So, if anyone do have any questions, please raise your hands or you can pop up your questions in the chat box. Yes, Nisar sir.
Am I audible?
Yes, sir. Yes, sir.
Thank you, Dr. Tahsin, for a wonderful, informative talk in the morning. This has become the order of the day now, you know it, because the youngsters all having a lot of issues than what we used to face earlier. I have basically three questions if you have time. The first question is, does the cholesterol actually, because there are a lot of research into it. In our time, it was 250 was the normal. Then it was brought down to 200. Then it came down to 150. So there's a lot of confusion as far as the cholesterol level. And I have two experience. One was my course mate, who was a very fit person who used to run 10 kilometers every day. And he suffered an attack when his cholesterol level was around 120, 130. Another gentleman who was overweight and he had about 300 to 400 cholesterol level. I'm talking about the total. And he does not have a problem. So what could be the reason? Is actually cholesterol related to the heart disease? That is the first question.
Yeah, so I'll answer that question and come back to you for the next. Actually speaking, cholesterol is a risk factor. When you are talking about medicine, it's a science of exceptions, and we should know the concept of probability in dealing with patients and dealing with all those things in medicine. For example, what people are expecting is that if you smoke, 100% of people who smoke should get a heart attack. If you do not smoke, 100% of people who are not smoking should not get a heart attack. It's not like that. That's why I told a smoker has got a chance 6 times more than the non-smoker. So that is the probability concept. It's like if you are crossing a busy road, what do you advise your children? You will advise them to look whether the vehicle is coming or not. If you are feeling safe, you cross the road. Okay. And let me ask you one question. If I'm asking 100 students to cross like that in a very busy 4-line track, and 100 students, 100 children, without looking, just cross. Do you think the first 100 will cross without hitting, and the next 100, everyone will die on the road?
Not at all. Not at all.
Not
The
at all.
probability
Not at
is
all.
both ways.
Yeah, the probability is that if you look whether the vehicle is coming and you are securing, you are doing your level best, the chance of getting a successful crossing is higher. If you are not looking at that, the chance of hitting by a vehicle is more, right?
Absolutely.
The same way, if you treat cholesterol, the chance of getting a heart attack is much less. And if you are not treating a heart attack, cholesterol, the chance of getting a heart attack is much more. How much that is, we will call it as the odds ratio. Odds ratio. That's a term we are using in the statistical analysis
Odds.
and the
OT.
impact. Odds ratio.
ODDs. Odds.
So if the odds ratio, that means everybody is having a chance, a particular chance. And if some intervention is reducing the heart attack, that if the impact of the intervention is very strong, that means the odds ratio will be very less. And I should say that there are so much of studies. I should say at least more than 1 million people are used studies, which all of them were shown that if you treat bad cholesterol, the chance of getting heart attack is very, very less. It is coming very low. But the cholesterol is not the only reason for heart attack. If you look at my numbers, 1, 2, 3 reasons, the first one I told you is not cholesterol. It is the makeup, person's makeup. So your friend who had a heart attack had a makeup which is more prone for heart attack, and the other guy didn't have that kind of risk in his genetic makeup. So if you ask more questions to them, you will get a history of some of their relatives will be having heart attack at a young age. So that's the reason. That is not related to the cholesterol.
So
Am I
genetic
clear,
also
or
matters.
should I? Then I have to repeat my whole talk.
Okay.
Genetics is the most important thing. If I must say, I haven't seen a heart attack less than 40 years without the person having a family history of heart disease, or a person is being a smoker. So smoking and family history of cholesterol is the biggest risk factors.
Okay.
Your second question?
The second question is, there's a lot of talk and research on chelation therapy, CHE, chelation. Because it was started by one of the heart surgeon in Bangalore, because I got it done for my father-in-law as well as my sister some years back. He is no more. He was the first person in 1971 who conducted an open heart surgery in India. So, but a lot of issues as far as the medical side is concerned, they are not agreed to it. But on ground, some positive results were also seen. So can you just give out, is it worthwhile to undergo a chelation therapy to reduce or cleanse your arteries?
It will not cleanse your arteries. This concept is actually very interesting to hear, but it will not cleanse your arteries. We used to see at least 3 or 4 patients per month coming after chelation therapy, or coming after one more thing is there called EECP, which is avoiding a bypass. And all these people are expecting that their blocks will be removed. It's not. And the issue is, if I want to create a treatment in India, maybe I can just say that I am seeing some sauce, some things in the kitchen. I can mix all those things and make one and say that this is very effective. It is possible. So what is the difference between a standard treatment and such a quack treatment? What's the difference? The difference is there should be backup studies. When I told you about the cholesterol, what did I say? I told that there are hundreds of studies involving more than 1 million persons. So that is what we require. Without that, none of the treatment we will not accept. We cannot accept. So that doesn't mean that chelation has got no use, but maybe I don't know. But from the practical sense, from the patients that I have seen after chelation, I do feel that it's not that effective.
Yep. And lastly, does deep breathing exercise on a daily basis, does it improve the lung capacity and the heart?
Definitely, they do. Heart capacity will not be improved by breathing exercises. If you want to improve your heart capacity, you have to make it run faster. Like you have to do aerobic exercises, increase the heart rate to 140, 150, maintain there, come down, again go up to 100.
That's why you
maintain
carry
there,
out
come
that
down.
TMT
Like that
test.
No,
to
TMT
check.
is for a test. It's not.
Yeah.
Yeah. That's for a test only. That's we are not checking on the heart rate. We are checking whether during that stressing period, whether the heart is getting adequate oxygen or not, or there are some changes in the ECG. That's what we are looking at.
Thank you so much, Dr. Tahsin. Thank you.
Thank you. Thank you, Nisar, sir. Now, Pandari, sir, could you please come up with your question?
Good morning, Mr. Tahsin. Dr. Tahsin, thank you for your good, valuable points. And my question is, normally generally says once you got BP or sugar, it cannot become again afterwards normal. Is it so? Or can you by what way you can bring to normal?
Blood pressure and diabetes you are talking about.
Yeah.
Once it is started, whether it is can be reduced to normal or not. That was the question, right?
Yes.
Yeah, there is so much of possibilities to make it come to normal without medicines. I'll give an example of my father. He was diagnosed to have diabetes in 2009. At that time, his weight was around 80 kilograms. He reduced his weight to 70 kilograms, and diabetes disappeared. He is not taking any medicines now. So his problem was overeating, not a good diet, and not having a good exercise. So with good exercise, dieting, and weight reduction, he could avoid antihypertensive, both blood pressure medicines as well as the diabetes medicines. For the last 10 years, he is not using any medicines. So it is possible. But the only issue is you should be doing something. Without doing anything, you can't expect it to reduce it by its own.
Yeah. For diabetics, do you have any, natural medicine other than English medicine?
There is nothing called English medicine.
Or your known best medicine for Ayurvedic or some other things? Or what is your suggestion? Because most
Actually,
of
I
people
don't know
about
about Ayurvedic medicines and all, but I should say from my experience is that this is an imbalance. The diabetes is an imbalance. So some of the factors which is making the imbalance will be the obesity, the diet, absence of exercise, and all those things. So if you do all those things, correct all those things, and give some minimal support with medicines, you can control the diabetes very well. The issue is still the problem is that diabetes per se is not a problem. The problem is diabetes will ultimately end up in heart attack. So the heart attack is the problem. So whenever we are getting a new medicine in diabetes, the first question asked by the medical professionals is that, how effective it is to reduce the heart attack. So without studies, without having good randomized controlled trials, we will not accept even the so-called English medicines. So even if we are not accepting the so-called English medicines from US or some other states, without saying that there is no adequate studies for those medicines, how can we accept those medicines which are sold without even a single study? So that's the problem.
Okay. Thank you, doctor.
Okay, welcome.
Thank you, Pandari sir. Now, Narsur sir, are you there?
Hello.
Narsur sir, okay.
Yeah, I'm there. I'm here. Happy morning, doctor.
Morning.
Okay, very nice. This is need of our doctor. Nice, good. Really, my daughter is doing MBBS. Actually,
Okay.
doctor, actually, I'm sitting with all, with her, doing all kind of subjects, reading. The two things is happening in the 5 Ms. I can say that the motivational speech, they give, like I can say, daughter for soul, and you've been giving like for body, daughter for body. So two things happening in this 5 Ms. They're doing great job. Heads of all
Okay.
people. So daughter for soul, daughter for body. So you have daughter for body. So it's very good, sir. Actually, yeah, that's right. So, sir, actually, now what you're talking about, your universal code and this and all, and a person, he can be a good person even if he's, smoking and all kind of habits, even stress, he lives, like anything, doesn't have any problem. The guy is got, is like, doesn't have any kind of issues, yet is having problem. So problem is, what is the best thing, to just follow? Say there's some they say having a non-vegetarian, okay, is not good for your body. Don't go for vegan or some organic food or something vegetarian. Don't go for after 40. Don't go for non-vegetarian. So a little bit confused. Even smoker also is the happiest. They lead a good happiest life. So as for I'm a trainer, what I used to say people, the skills hacker like simple rules for your happiness, free your heart from hatred, free from your mind from worries, live simply, give more, expect less. These are all packages, to make you happy and get rid of all diseases. But technically or medically, when you're talking about what is really requirement to be in a successful person, free from all disease, can you just throw some light on that, please?
It's
Thank you very
very
much, doctor.
difficult. But I can say that there's common factors are there which has got links to many diseases. So one of them is smoking. Smoking is injurious to your health, means it increases the heart attack chance to 6 times. The cancer of most of the cancers are increased by this one, specifically lung cancers and breast cancers and so many things. And the smoking increases pancreatitis. So many diseases are increased by smoking. And same way, alcohol, excess alcohol also increases so many diseases. Stress, so many things are related to stress. Your inflammatory levels will increase. So stress is also important. And diet and exercise. So whatever I said in the previous, in my talk, that is to reduce the stress, balance your diet, have a good exercise program. It not only helps in heart attack, it helps you to keep you healthy in all the ways, mentally and physically. And there are no specific mantras for being healthy. Being healthy means you should be healthy physically, you should be healthy mentally and spiritually also. So health is defined in that way. So once you are saying that you are healthy means you should be healthy in all these spheres. And it's just not the absence of disease. So health is defined by WHO is like that. It's not just absence of disease. It's state of well-being of the physical part, mental part, and spiritual part. So all these three things should be. And this 5 a.m. club, there's such clubs will be helping you. And another part I found out is to make you happy and healthier is to have some reading programs. If you have reading as part of your life, it makes you happy and gives you more information also. So I'm not an expert in motivational talks or things, so I'm not saying anything, and you will be knowing better than me. Thank you.
Yes, doctor. One more thing. Actually, even you're not a motivator, I know, but the way you're talking to us, so so calm and composed. You're just talking as if you are giving prescription to as if you're like a patient. that the way
maybe,
we get cured.
This is actually maybe my 200th talk or so.
like a divine prescription, sir. Very nice, sir. So one more final question is that taking a tablet, if a person takes tablet for any kind of a disease, then he feels that people have what they don't take tablet, taking tablet always gets side effect, this and that. 30 years, 35 years, you're taking this much tablet, taking like a snacks. So stop taking tablet, go for like natural kind of exercise and this and that. So is it okay? This is okay for you. So is it okay, doctor? As a taken medically is saying, is it advisable? Person who's been taking tablet and stop taking and doing something in order to avoid from those side effects. Yeah, go ahead. Thank you.
No way. Actually, if a person is having extra cholesterol, like a familial hyperlipidemia, basically because of the familial makeup, somebody will be having a very high cholesterol. So if he's not taking a cholesterol tablet on time, maybe his cholesterol will be very high from the age of 25. And he has detected that he has got excess cholesterol at the age of 25. If he is not taking tablet, even if he runs the entire day continuously, and even if he is fasting every day, and even if he is not taking a single piece of cholesterol thing into his diet, he will have the heart attack before the age of 40 years. But if you take that tablet, reduce that cholesterol to the normal level, even if he is not at exercising, even if he is depressed, even if he is having an uncontrolled diet, still his heart attack will not happen within 4 days. So that the power of well-directed medications is hundreds and hundreds of times than the so-called the exercise and the diet and all those things. So that's why I put the first thing as first, the genetic makeup. Genetic makeup of a person is very important. So if this person's genetic makeup is with a hyperlipidemia, familial hyperlipidemia, that means his cholesterol is genetically high. We cannot conquer that with some exercise or stressful living things. No, it's not possible. So the impact of medicines is very powerful. They are very extremely powerful when they are directed in a correct person. So that is more important. Everybody taking statin may not be that effective. For a single person, individual person, a named person who is having the disease, taking a tablet is the most important thing that he should do correctly. That makes him healthy.
Thank you, sir. So, Ajit sir, please come up.
I think I'm seeing some questions in the chat box also.
Yeah.
How to recognize if it is angina or it is due to acidity or indigestion? Please clarify, doctor. This is a good question. There are so many questions previously also. I'll come back to that questions. So angina is it's happening in the upper chest, this part, upper chest, central, not a pointed one. It is spreading all over the chest, and it's a feeling which that person may not have previously. So many of them, if you ask most of these heart attack patients, what was the feeling? Then they will say that it's the feeling was kind of gas. Then if I'm asking them, did you had gas feelings previously? Yes, I had gas feelings previously. Whether this particular feeling was similar to that previous gas feelings? No, that was different. So this is, in the beginning, they will feel that this is gas. Then they will understand that something different about it. That something different is basically because of its spread, its character, its intensity, and sometimes it will come to the throat and arms and back. Now, gas will never come to the throat. Gas will never come to the arms. Gas will never come to the back. So that kind of thing is happening heart attack. So that's basically the character of angina. That was the question that we answered. So many questions were there. Any
Yeah.
questions directly?
Yeah, sir. Ajit sir, please come up with your question, sir, please.
Yeah, thank you, Jessina. Thank you, Dr. Tahsin. Wonderful information. And I have a question which is actually very critical and pertinent as of now, because my dad was hospitalized for 2 days and he's just back home yesterday afternoon. The case is that Sunday night. Are you able to hear me clearly?
Yeah, I can.
Yeah, okay. Sunday night, after having dinner, he vomited, and he vomited whatever he had had, and then continually for almost 2.5, 3 hours he was vomiting. So even small, little water what he was having, he was vomiting. We gave him medicine, antacid, that he vomited. We gave him a blood pressure medicine, that also he vomited. And somehow then later on he got pacified and he slept. For Monday it was okay, but Tuesday again he started burping in a lot, belching, burping, and we admitted him to the hospital thinking that it is something related to heart problem, because I thought that belching and burping is because of heart and angina related. Now, yesterday he was discharged. His BP, we were told that the BP was very high. It was 200, 210. So we thought, okay, that is it. But then yesterday we realized it is because of some creatine. So my question to you is this continuous belching, burping, and that heavy head, is it only related to the creatine or is it something related to heart? He has a history of heart issue. It is genetic also, and he's had major issues earlier also, but he was cured. But now in this lockdown, what has happened is, what my feeling is, because of sitting at home and not going out for walking and all, and it has taken a toll on his mental level also. So please help in getting some clarity as to what is the situation now. Is it something related to the heart, or is it just the kidney, or why is this happening?
I can give some concepts, but I cannot say that may be uh, uh, the main thing for your father, because the best person to talk about that is the consultant doctor.
Yeah.
Heart attacks can cause vomiting, especially inferior mice can cause vomiting, but the continuous vomiting in heart attacks is very rare, extremely rare. It can cause vomiting, but it's very rare. And if the creatinine is high in a patient with kidney disease, creatinine is high, they do have such kind of vomiting. And the headaches are basically due to high pressure, high blood pressure. And the high blood pressure is there, without even raise in creatinine itself, they can have headache and vomiting. So headache and vomiting can be explained by the high blood pressure. On top of that, if the creatinine is also high, then the problem will be, there is a kidney disease which was worsened, creatinine is high, and the kidney disease itself is causing high blood pressure. And the high blood pressure and raised creatinine is causing the headache as well as the vomiting and this one. I don't think heart disease will be there inside in these symptom set. Most probably, this is only due to the raised creatinine and the raised blood pressure.
Okay. Fine. Thank you, doctor. I
Okay.
understand that the consultant doctor is the best person, but I thought since you're
Yeah.
here, I thought I'll just take
No
some
stress,
advice
no
from you.
stress. I can blanket statements I can give.
Yes, yeah. Thank you.
But I give specifics to that.
Yeah. Thank you, doctor.
Thank you, sir. So, Hema Thakur, do you have
Yeah,
a question? Yeah.
yes. So thank you, Dr. Tahsin. That was a great insight about cardiac, and it's a major issue that's going around the world. So my question to you is, what are the chances of a survival of a cardiac person who has undergone open heart and as well as bypass surgery? I mean, how do you justify that? If a person has gone both the operations simultaneously, and the lifestyle is just okay, not very good, excepting in 1 hour of a walk per day, if the person is just with the same thing, what are the survival chances?
Um, that's a very difficult question. There is something
Sorry.
called Euroscore. There is something called Euroscore, EURO score, Euroscore. That
Okay.
Euroscore detects the chance of survival after the surgery. It has got a lot of information. It requires a lot of information like how's the patient status, how's the pumping, heart pumping, and which all surgeries are being done, and how's the creatinine level, how's the patient's pH level, and all those things. So if you feed all those informations to the Euroscore criteria, you will get a picture. Usually, if the patient is relatively healthy, a bypass surgery, the survival after bypass surgery is around 97%.
Okay. And one more question added to that is, latest I've been, going through from last 3 to 4 years, I think I'm just with this, the combination of that garlic, ginger, honey, and apple cider. That's been in, I think it has come from US, and people have been making that combination and then having it as a dosage for the reduction of cholesterol. How do you justify that?
I don't know. I don't know about this combination. And
How do you feel apple cider is really an helpful product?
I don't know. I'm not sure. We don't have good studies to back up all those things. Without studies, I am not in a good position to comment on apple cider. That's the issue. And regarding the concept that there's something coming out of US, I recently heard a wonderful news read. This Donald Trump told in a talk that to curb the problem of corona, why don't you use your sanitizers and drink some sanitizer so that the corona in the throat and the stomach will be removed by the sanitizers. You had that? You heard that?
I read it also.
37 people became critical in US just by hearing that and drinking this sanitizer.
I know.
So don't think that US is something special. There are people who are dumber than Indian people.
Thank you, sir. Thank you, doctor. That was wonderful.
Okay. Thank you, sir, for that nice answer. So, anyone else? Any more questions? Okay. Krishna Prasad, sir.
Listen, I do have a meeting at 9:30. So,
sir, good morning, doctor. It's a good session. I have a couple of questions.
Good morning. Yeah.
Good morning. One is vegan food really help reduce cholesterol. I see some people completely stop taking milk, curd, and other milk-based products. Does it really help? Even I see youngsters stopping that in the age of 20, 25.
Can I answer that question?
Yeah, please.
There are two types of things when you are talking about cholesterol, which you should not mix together. When I was talking about cholesterol, I was talking about blood cholesterol, the cholesterol which is detected in the blood. And something new is the dietary cholesterol, which is the cholesterol which is there in your diet, which may be absorbed into the body depending on your body cholesterol level. So the cholesterol which is in the blood it is coming from two sources. One source is your diet, those coming through your food, the meat, the curd and all those things. And the second part of the cholesterol is coming from endogenous production in the liver. Liver itself produces cholesterol. So if your dietary cholesterol is less, the production by the liver increases. Even if your dietary cholesterol is high, the production from the liver is less. One part. Second part, if your dietary cholesterol is high and your blood cholesterol is high, already high, then the intestines will not absorb your dietary cholesterol fully into the system. It will block at the intestine level. So the role of dietary cholesterol, which is connected to the role of the connection between the dietary cholesterol and blood cholesterol, is not that well defined. Their studies are still going on, but in general, in my feeling is that if your dietary cholesterol is so, then it will affect your blood cholesterol. If your dietary cholesterol is intermediate, medium level, then it will not affect your blood cholesterol. So you can have some amount of fat, cholesterol in your diet, either through the vegetarian sources or through the non-vegetarian sources. That's not a problem. And all as such is required for the purpose of maintaining these membranes, like especially the brain, the myelin, the cell membrane, all of things requires cholesterol. All the hormones are produced using cholesterol. So it requires cholesterol. Body requires cholesterol for its normal purpose. When it is so excess, it is damaging. So I used to advise my patients. Even yesterday, one guy asked after heart attack, he came and asked, "Can I take egg?" I told yes, 1 or 2 eggs per week, no issues. If you want to take daily, then 2 days per week you take full. The other days you take the whites. So it's not a problem.
Thank you, Doctor. That helps.
Thank
And
you,
my
sir.
second question,
Okay.
just one last question. Sorry.
Okay. Fine.
Sure.
Doctor, you mentioned about probability in your talk. Artificial intelligence is all about probability. You may be knowing, and in US healthcare, they're already using AI, for detecting a cancer or not. But I'm not seeing that in other parts of the world. How is the acceptance from the doctor community about this AI? If the AI give the results, do you rely on that? How is it perceived? Just wanted to understand from your community.
The algorithms produced by the artificial intelligence is not up to the clinical level now in most of the diseases, but it will come soon. So we do take that concept and probability. Artificial intelligence takes care of most of the probability concepts, and it gives some idea how it is going. But still, I feel that the final decision will be taken by a doctor, a human being, who will be more concerned about so many other things about the patient. For example, I can tell you one thing. My patients who are coming at an age of 40, 45 years, I used to ask them to be very strict on their diet, very strict on their exercise. And I do check to their relatives whether they are going for exercise and what is their diet and all those things. But when the people are coming at an age at around 60, 75, 80, and they are very weak, and the heart is also weak, usually this person's children used to ask me, the son or the son-in-law will ask me whether this person can go out for prayer, or whether this person can go to the market or his friend's place, or ask me to forbidden him for going out, and request me to forbidden him from taking meat and all those things. Then I outrightly reject this request and tell them, and without this, that patient will be kept outside the OPD and tell these relatives that whatever you do using these medicines and all those things, the chance of his survival more than 2 to 3 years is very, very unlikely. So let him have his life by having good food, by having good friends, good community living, and don't prison him inside the rooms by forbidding him from going out and forbidding him from taking good food and all those things. So this kind of humanitarian touch will not be there with AI. That's the issue with AI.
So I think you can have maybe something like some threshold. Suppose if it is less than 0.5, you can rely on the AI technology. If it is in a border case, no, I'm saying what I'm saying is, no, suppose if the probability is say less than 0.5, I'm just like taking some number.
Yeah.
You can rely on that. If it is above 0.5, maybe then the doctor's intervention is required. Maybe
That's for sure. That's for sure. That is when I was talking about this all these trials, no. So the results we are assessing with the p. If the significance of the p-value we are taking at 95% confidence interval, so that means the p-value of 0.05. Less than a 0.05 only we'll take that decision. So the same can be applied to the AI also. That's a fantastic point.
Okay. Yeah. Thank you, doctor. Thanks.
Okay, yeah.
Thank you, Krishna sir. So one last question and let's wind up the session. One last question. Anyone else? Okay, Tulsi ma'am.
I think doctor has to leave, Jessina ma'am. So let's conclude.
Yeah. Sure.
Good morning, sir. It was a very informative session. I would like to know that those who are taking medicine for cholesterol, at what interval should they go for the next checkup?
Once stabilized, let us say we will be starting with a very low dose of 5 mg or 10 mg, and at 1 month or 2 months we will check up whether this dose is enough to control the blood cholesterol. Once it is controlled with that level of dosing, and we have our titration is done, then once in 6 months may be enough.
Okay. Thank you, sir. Thank you, sir.
Thank you, Tulsi ma'am. So now let's wind up. So I myself take privilege to propose for the word of thanks. And first and foremost, a hearty thanks to our eminent chief guest of the day, Dr. Tahsin Nedwanjeri, who has delivered such an amazing speech over here. Sir, actually, we do have many questions. I think we can't end up with just having 2 or 3 questions. We do have lot more questions, and always we are seeing people around us with different symptoms. So always we are in a state of doubt. What are the real symptoms of cardiac arrest? And so on. So we do have many doubts, and most of our doubts were cleared here. Thank you so much, sir, for your valuable information sharing here. And thank you for joining us from your hectic schedule. And it was great hearing you, because nowadays it's like this ailment goes undetected. We don't know how it comes. It's not properly diagnosed, and as many of us take it as silly as like it would be like gas trouble or something like that. We don't want to conclude it as a heart attack. So it was from your speech we got low. So we were able to take so many elements, so many steps that really were knowledgeable, and it really clarified our doubts. And thank you so much, sir, for being with us. Please do join us again for clearing more of doubts. Once again, thanking you. And I thank our organizing team for being always the backbone of our 5 AM club and Ignite Minds for making this event a resounding one. And last but not the least, I would thank a new joinees for always supporting us and cooperating with us by being with us throughout. And let me conclude by this last message, this valuable message. If you want to change your life, begin by changing your words. Start speaking the words of your dream, of who you want to become, not the words of fear and failure. So, by this, I conclude, thanking each one of you. Have a nice day. Thank you once again. Bye.